For many of us, it is the most important commitment to take care of our loved ones. We feed, as the Beatles song goes, and we work hard to ensure that those close to us are thriving. Today, there are 53 million people taking care of their parents, neighbors, and friends. And there are 53 million stories. From the Stanford Center on Longevity, this is When I'm 64, the podcast for caregivers. I'm your host, Ken Stern. Many of us take care of our loved ones, usually for no pay. And we know that the difficulties of caregiving are endless. But these challenges are compounded in communities of color, where caregiving is often not just what you do at home, but also at work. Today we meet Zulma Torres, a direct care worker.
My name is Zulma Torres. I work for Cooperative Home Care Associates. I'm a home health aide. Typically, we go and we provide a service for patients that are in need, that needs assisting, and we bring life to them. Rather than being in a hospital, in a nursing home, we go in there with love, with compassion and understanding. You know, we actually connecting, and we're all the person has. A lot of our patients don't have family members, and if they do, they're out of state. So we come in and we have a big purpose on what we do. It's not easy what we do. It's really hard, but you learn to love it.
Zulma is also a caregiver in her own family.
Well, you could actually say that because I'm raising my 4-year-old granddaughter, my son's daughter. Her name is Karyne. I love her so much. She's 4 years old. We found out at 2 years old that my granddaughter was autistic. I knew something was wrong, but I didn't expect it to be spectrum. But we accepted it, and we worked as a team. You know, her mom and my son. We put her in a little school, and we do Zoom with her, for her to learn ABCs, for her to speak more, for her to play. She's very lovable, but she doesn't speak directly. She will point at things, and she likes certain things and she don't like certain things. So it's a learning experience, because normally our 4 children are speaking, but she's not. But she's just she's just wonderful, and I have faith that she will speak one day.
Direct care work, a category which includes nursing assistants and nursing aides, home health aides, and personal care aides, is taxing and not well paid. And as we know, so is family caregiving. Making both work takes coordination, help from the community. If just one plan fails, it could put everything else in jeopardy.
And if it wasn't because of the team that I have within my family, I don't think I would have been here right now. I wouldn't. So I'm grateful to that. But I'm going to tell you a quick story. I actually live in Connecticut, and I work in New York City. The beginning of the pandemic, my son-in-law and my daughter decided that, being that my son-in-law works night shift, he was able to pick me up in the mornings to bring me into New York, because I was taking the Metro North. It's 3 hours to get to New York, 3 different trains. And I was really worried. One of the second train, that is the train from Stanford to New York, that train was the first train that got infected with the COVID. So it was very scary. So they started picking me up and bringing me back and forth. I was blessed with that. But now things are opening up. They have to go back to school. My daughter works in a school. She's an educational specialist. My son-in-law works in a hotel. So he had to take my daughter to work, and my grandson is doing Zoom from home. With that being said, I travel back and forth now again on my own. So it becomes a little difficult when I get home, because I'm only home about 3 days. So in those 3 days, I want to clean, I want to shop, I want to take care of my granddaughter. It's hard, but I make it happen. Sometimes I become disappointed because I want to do more, and I can't. I don't make enough money to say I'm going to take a day off, even though I've been working for so many years. Right now, we make $15 an hour. I started with Cooperative at $6.25 an hour. Now, almost 24 years later, I only make $15 an hour. They do give us a differential on the weekends. What I consider a fair pay, boost it up to 20 and better, and keep it going from there. Because we have family, we have to travel, we want to provide. But if our pay stays the way it is, how far can we go? It's not a lot of money. And I tell you for myself, I play with my 401k. That's what saves me. What I have done is that I have learned to save a little with the little that I got for a rainy day. And it's hard because we've really got to budget ourselves. And bringing in a certain amount of money weekly that we know is not a lot, and to pay rent, light, gas, and everything that we all pay, and to save a little, besides my traveling money, besides my eating money when I'm in New York, here it goes again. When you have love for and compassion for something, you find a way. But on another note, it worries me that if I get sick or that I cannot work, I don't have my perks anymore. I won't have my life insurance. I won't have my union. I won't have my 401k because they'll give it to me. And if I don't save that little bit, I don't have anything.
These issues are not new, but the pandemic put a spotlight on them because direct care workers like Zulma were being asked to do the difficult work they always do for little money and now with the risk of acquiring a life-threatening virus.
It was very scary, extremely scary. The same way it was for me, I assume for everyone else was very scary. And in my home, they was like, no, you have to take off. This is scary. Don't do it. And I would tell them, I understand, but I'm going to continue protecting myself. I'm going to do my social distance. But I felt good in spirit to go help out because I know that these patients in home, especially those that don't have family, need us. And I felt sad not doing it. And yes, of course, we all work for the money. But when you work with love, you know that person needs you.
Thankfully, Zulma has been safe this past year, but she's got a message for us.
I don't know what's a hazardous pay. I don't know what's a bonus pay. All I know is what I get paid weekly. It haven't changed. I feel that it's unfair. I feel they left us behind. And I'm hoping that they do raise our paycheck and we get fair pay because we deserve it. Help us, help others. That's the only way it's going to get better. A lot of aides, for an example, when the coronavirus came out, a lot of them stood home. You cannot blame them because actually them staying home, the government was giving out an extra $400 a week what they were making. So let's say they were rounding off to $700 or $800 a week. It's twice, it's a percentage more than what I'm bringing home. But I stood working and I don't blame them because we all scared. But if they was to treat us a little bit better and acknowledge us, I think more aides will come out and say, you know what, we could do this. Like I said, I did it for my own experience because I have the love for my job and I really wanted to be there and I have a great team. They would have their story, but this one is mine.
That was Zulma Torres, a direct care worker and family caregiver. A few weeks ago, I hosted a panel discussion on caregiving in communities of color. It was a fruitful hour-long discussion, and we've adopted it for this episode of When I'm 64. We hope you enjoy this excerpt, and if you want to hear it in full, you can do so at www.longevity-project.com.
The issues surrounding caregiving in communities of color are substantial, especially in the broader context of the pre-existing challenges on issues of racial equity and of the caregiving crisis in America. Fortunately, we have an extraordinary panel with us today to help us unpack these critical issues. Jean Accius is the Senior Vice President of Global Thought Leadership at AARP. Karyne Jones is the President and Chief Executive Officer of the National Caucus and Center on Black Aging and of its Housing Management and Development Corporation. And Kezia Scales is the Director of Public Policy at PHI, where she has led groundbreaking work on the direct care workforce and its relationship to long-term care. So let's start off with you, Karyne, if I could. And let me start asking sort of a two-part question. Would you mind sort of taking a moment, telling us about the National Caucus and Center on Black Aging, and talk to us about your reflections on caregiving during the pandemic?
Well, thank you, Ken. NCBA is the oldest minority aging organization in the country. A big part of what I do is advocacy, and we certainly work to try to maintain and try to increase support for services for our older population. The pandemic was a shock to all of us. When COVID came, as you well know, the communities of color were disproportionately affected. But that, of course, was just something that the pandemic added to, unfortunately, the isolation and some of the other issues. but it's not anything new to NCBA because we've been having difficulty with communities of color being able to reach and get the kind of support and resources that were needed to help them in this process anyway.
So let me bring you into the conversation, Jean. I'm not going to ask you about AARP. I think I'm going to assume everyone knows AARP, but tell us your observations on caregiving during the pandemic and the specific challenge you've seen faced by communities or caregivers of color.
Well, thank you so much. I want to pick up on some of the things that Karyne mentioned in terms of the pandemic itself within the context of caregiving, and just really kind of amplify a couple of points, if I may. One is that, as we all know, that the pandemic has disproportionately, as Karyne indicated, impacted communities of color. It also disproportionately impacted older adults. And at a time in which where we saw a couple of trends. One was not just the impact of older adults in nursing home facilities, and we saw what happened throughout that situation, but we also saw a lot of closures in terms of adult daycare and social services, which, as you could imagine, disproportionately added additional stressors, if you will, to caregivers. On top of the pandemic, we also saw some other trends as well, and that is the racial reckoning that's happened across the country. So for many caregivers, they were not only having to deal with being a full-time caregiver around the clock, they were also having to think about how do they provide the care in a way that does not further jeopardize the health of the person they're providing care to, while at the same time potentially working. We know that 60% of all caregivers were working. So as you can imagine, there's been compounded stressors, particularly for caregivers more broadly, but specifically for communities of color because of these added layers of complexity. And I think that one of the things that we want to talk about, particularly as we think about the caregiving population, we know that 17% of all family caregivers are Hispanic and Latino. 14% of all caregivers are African American, Black. 5% are Asian American and Pacific Islanders. And we've done some work at AARP that has shown, particularly last year when we released this, that there's a growing number of African Americans and Hispanics who are taking on more and more care of adults, of their parents, because of the aging of the population. So you have these magnitudes of challenges that we really need to think about what are the ways in which we can really address these in a very systematic and more equitable way, because one cannot separate themselves from the larger ecosystem in which they have to operate.
So let me just ask you that Jean, since you sort of basically sort of asked the hard question there, how do we address them? What are, in your view, some of the first things that we as a country need to do to help address the challenges faced by caregivers in general, but also more specifically with communities of color?
Ken, I'm happy to answer that question, and I'll also turn to my colleagues to add to their solutions as well. So I think there's a couple of things that we have to do, and we're seeing that now, and the question becomes, is this a movement or is this a moment? And I think that's what we need to really kind of be intentional about. The first one is why we're having these conversations that we are having today. I think it's important for us to really embed the issue of equity in the core of everything that we talk about and everything that we do. We need to ensure that we are meaningfully engaging the communities as part of the solutions, and then more importantly, to look at communities from a position of strength and not necessarily from a position of deficit. And then finally, thinking about the opportunities to identify, track, and collect and incentivize in a way that really creates the systems that we need in order to address these cascading effects.
So let me bring Kezia Scales into the conversation. You know, at the Longevity Project, when we talk about caregivers, we usually mean family caregivers, but the prevalence of people of color and really women of color and the very difficult work of paid caregivers made us want to include that as an important part of this conversation. I know that's sort of what you studied, so would love it if you would just take a moment, tell us about your work and some of the challenges that women of color who are paid caregivers face during the pandemic and the path forward.
Thank you very much. And I'm really so grateful and glad that you are including the direct care workforce in this conversation, because they really are the complement to the family caregiving care force, if you will. They are the paid front line of caregiving. And I think that there's three ways to think particularly about how thinking about direct care workers factor into this discussion about caregiving and communities of color. The first point is just to really problematize the distinction between these two categories, because of course they overlap significantly. Family caregivers may be paid for some of their caregiving contributions. And on the flip side, paid caregivers are very often themselves family caregivers as well. So they are juggling their unpaid caregiving responsibilities with their paid work, just like so many other family caregivers. That's one reason. A second reason is that I would argue that whether or not direct care workers are actually in the mix in any given caregiving situation, they almost always matter to that caregiving equation. So what I mean there is that when they're there, they can play such an important role. And when they're not there because they're not available because of the workforce shortage or because there are not funds available for paid services, then they are felt in their absence. There's more pressure and stress on family caregivers. There's less support, there's less respite, and so forth. And then the third point you have already made, but I will just reinforce it, which is that this is a workforce that is predominantly people of color and immigrants as well. So then just to speak to the experience during COVID, what I would say is that this workforce was on the front lines of the COVID pandemic all the way along. And as a majority people of color workforce, these were workers who were already at higher risk of exposure to infection and serious outcomes. As low wage workers, they weren't able to, they were still using public transportation. They were still doing hands-on care. They weren't able to socially distance or isolate themselves. And in many cases, they were doing all of that work without additional supports, without additional pay, without adequate access to PPE or training in the moment, and without adequate paid leave and other supports as well. So they were bearing the brunt, they were sharing the brunt of this pandemic without enough support really to do that well. And I think it was a very damaging experience for the workforce and very traumatizing as well for those who were involved and who lived through it.
Let me just ask you a quick follow-up on that. Is there, in your view, anything good that comes out of the sort of the more greater visibility that paid caregivers have had for the last year?
Yes, I think that's a great question, and I would borrow and maybe corrupt Jean's expression of, is this a moment or a movement? Yeah. I think it depends what we do with it. So we do have much greater attention on the long-term care system, our caregiving system, and all of its shortcomings and challenges, and on this workforce as well. And the challenge now is really to capitalize on the moment and implement changes that will be sustained and that will really transform these jobs and the caregiving infrastructure that we have going forward. And I think there's I do feel really hopeful in this moment because it's not just rhetoric. We do have proposals that are out there. We do have legislation that has been drafted and introduced. There are really promising opportunities to actually put our money where our mouth is in terms of investing in long-term care and in home and community-based services in particular, and in the jobs of those who provide these services. So I think that is absolutely the silver lining, is the learning that has come out of this tragedy. As long as we capture as much of that learning as we can and use it to invest in policies and other changes going forward that will really make a difference.
Karyne, let me ask you this. As someone who's been in the halls of government, working on Congress, working in state legislatures, working in the executive branch, what do you think are the prospects for change coming out of the pandemic?
Yeah, as far as the way the political part of it is, we are a very, very short attention span society. And right now we are putting a lot of emphasis on equity. During the time we went through COVID, we were also going through a whole racial reckoning with the George Floyd and all of the other things that were going on. We certainly then got a real hot spotlight placed on health inequity and why people in certain communities were being much more affected by the virus than others. So the lens is on it. The spotlight is on it, but it's going to require a swell within the population to try to make the changes. It's not going to come necessarily from our legislators, state, local, federal. It really has to come as a swell from the population itself, because supposedly they represent the people. And so we've got to make this a priority. We've got to make it so that people understand that as we have a growing older population, that caregiving is going to be a major part, because everybody won't be able to be in a nursing home. Everybody won't be able to be in a memory care center. Everybody won't have access to those things. And so how then do we support caregivers of families? And how then do we value more people who work in these facilities to care for the people we love? We just got to decide on where our humanity is.
Let me change the topic for a little bit to talk about the healthcare system and the challenges that caregivers of color have in navigating the healthcare system. So can I start with sort of just ask you to explain sort of the challenges that you've seen that people of color have in navigating our healthcare system, and sort of the invisibility trap that many caregivers seem to face?
Well, it's not just caregiver, it's communities of color in themselves and their long history of mistrust of the healthcare system. And that has certainly been documented with all the medical experimentation that has gone on. It's a whole lot of things that have to change within the healthcare system in terms of the distrust that's already there. But obviously, people have to go to the doctor and people need access to healthcare. So we've got to work on changing again. And it's all racial. It's all how we value other human beings. And so there are a lot of barriers in terms of not only just not having healthcare or being underinsured. All of those issues come into it, and most of the jobs, as Kezia pointed out, with the direct care workers, certainly with a family caregiver, they don't have health insurance. And so as a result, that is a major barrier for them to even be able to take care of their own health. And if they can't take care of their own health, they certainly can't take care of their, anybody else. So we've got to change the way we look at healthcare in this country.
So Jean, that's actually a great segue to something that we all are in all together, which is the vaccine. So I'm curious your take on the role of caregivers in vaccine adoption and how that has gone in communities of color, where there's been both effort and challenges around getting adequate penetration of vaccines.
I really want to pick up where Karyne left off. I think the issue of trust or mistrust is critically important. And I think the question that we have to ask ourselves is, particularly in the context of people, the term vaccine hesitancy and things of that nature. And I think the real question is not necessarily vaccine hesitancy, it's more so, what are the institutions doing to be trustworthy? And I think that is something that we really need to kind of think about. When we say hesitancy, the burden's on the individual. However, we have to look at a much broader ecosystem. And that means, why is the institutions not trustworthy? I don't know any relationship or any interaction that is sustainable and that is healthy if there's a lack of trust.
So Karyne, let me just ask you this in follow-up. What's the role of government? What's the role of culture in solving some of these problems of mistrust and misinformation in a pandemic of misinformation?
If we as a society, as communities, do not hold our representatives accountable for not just saying no to everything, but being responsible for coming to a table to come up with some solutions. The problem we have now is that you're on this side, you're on that side. And so if I don't get everything I want, then it doesn't happen. If I don't get here, I don't. And we can't continue to operate like that. This country was going to implode if we don't see more innovation, if we don't see more coming together. And so we've got to really get over this.
Just real quick, just thinking about, I mean, really absolutely endorsing what Karyne is saying, and also thinking about how we just have to tackle this in a multifaceted or holistic way, because we saw during the pandemic that posters went up that said, you know, support our heroes, or heroes work here, or clap for the caregivers, those kinds of cultural sentiments, but they didn't mean very much when they weren't accompanied by hazard pay and paid sick leave and the kind of basic life-sustaining supports that these caregivers in the paid caregiving space really needed. So I think that we do need public education to change the hearts and minds of society about the value of caregiving. And we need to elevate the voices of caregivers, and particularly caregivers of color, both family caregivers and paid caregivers. And then we also need those structures, those public policies in place that will help sort of boost these roles from the bottom up and make sure that they can't be seen as anything but valuable and essential and worthy of investment, because they're already there. That's how they're being structured and built and invested in.
All right, time for my lazy moderator question. And I think this time it'll go, you have 1 minute in an elevator ride with President Biden. What would you say to him that he needs to get done this year to help family caregivers or caregivers in general, and specifically caregivers of color? What's the one thing, if he could do one thing, what should that be?
I would say that President Biden has taken the first step toward addressing this with his infrastructure plan, and really emphasizing that caregiving is part of our national infrastructure and is just as important as bridges and roads and buildings and broadband and everything else. So I think continuing to champion that and push investment into home and community-based care in particular, because that is where people prefer to receive care across different communities, across different groups, and also investing in the direct care workers that help ensure that individuals can access the care when and where they need it.
Jean, what would you say to him?
I would say two things. One is address and ensure that the investments that are being provided and distributed are distributed in a very equitable way to address the disparities, gaps, even within the context of home and community-based services and within the context of the delivery of long-term care. There's still significant equities that we need to address. And then the second, very selfishly, I would say, Mr. President, please go ahead and endorse the Credit for Caring Act that we have pushed out as an organization.
Fair enough. It's your minute with him, so that makes perfect sense. Karyne, what would you say in that minute?
Very quickly, I would just say, well, first of all, thank you, President Biden, for what you have done and for making equity a part of every part of any legislation or anything you're moving forward. I appreciate it. And again, acknowledgement is the way that we address it. And the other thing is to really encourage employers to implement caregiving friendly workplaces. I think what happens is he probably gives some guidance in helping employers to understand that as the population ages and they all understand the demographics, that it's important that they really try to become a workplace friendly environment for people who have to deal with caregiving.
Great, thank you. Thank you, Kezia, Karyne, and Jean for this really wonderful conversation.
Thanks again to our panelists and to Zulma Torres. If you'd like to hear this conversation in full, please visit www.longevity-project.com. Support for the Stanford Center on Longevity comes from the Annenberg Foundation, dedicated to addressing the critical issues of our time through innovation, community, compassion, and communication. Carrie Thompson and Ava Ahmedbegi are the producers of When I'm 64. Please like us on iTunes and leave us a review. You can find out more about us by checking out our website, longevity.stanford.edu. You've been listening to When I'm 64, the podcast for caregivers. Thanks for joining us. I'm your host, Ken Stern.